The Omicron variant is on the move. Countries across the world are starting to see a dramatic rise in the number of the daily recorded cases of COVID-19. First to experience the dramatic surge in cases was South Africa, but the early data suggests fewer people have died or require hospital treatment compared with previous waves of infection. Michelle Groom of the National Institute for Communicable Diseases told a news conference that hospitalisations aren't increasing at such a dramatic rate. She added, "We're starting to see some increases, but relatively small increases in deaths." The UK's surge in COVID infections saw 88,000 new cases reported on Thursday. It comes as France prepares to introduce strict travel restrictions on visitors from Britain in the coming hours. France has also now approved the use of vaccines for all children aged 5 to 11. With healthcare systems across Europe now starting to come under strain, the President of the European Commission says vaccination is the key to fighting Omicron.
We know that our healthcare systems are overstretched right now, and this is partly linked to the large number of unvaccinated patients. So in conclusions, the answer can only be to increase vaccination, to include children above 5 years old, boosting and protective measures. That has to be the answer we give to this new variant.
Well, let's get the latest now around Europe from Paris, Berlin and Prague.
Here in Paris this afternoon, there's a meeting of what they call the Health Security Cabinet to discuss the spread of Omicron, and it's expected there will be new measures announced. Maybe nothing too drastic, but certainly there's a feeling that Omicron is coming and something needs to be done. But the figures in France are not good. We're heading towards a new spike. 65,000 cases of COVID every day being reported, which has not been seen for a long time. Most of those are not Omicron. The vast majority of them are the Delta variant. But it's widely believed that the number of Omicron are being underreported because not properly diagnosed. It's in response to that and that expectation that, of course, we had yesterday this announcement that France is to introduce these much stricter rules on travel from the UK. The UK, where Boris Johnson is talking of a tidal wave of Omicron about to break. The French want to delay the spillover of that into the UK, which is why they've essentially banned non-essential travel from the UK over the Christmas period.
Well, here the Omicron figures, officially at least, are actually still relatively low, but they are causing enormous concern amongst experts. And we know from a couple of German states that either confirmed or suspected cases are already in triple figures. And experts say that by January, Omicron will be widespread here too. It is a massive concern because it's come at a really bad time for Germany, which has been experiencing a really aggressive fourth wave of the pandemic driven by the Delta variant. Now, cases have started to come down, but experts even this morning are saying they're not coming down quickly enough. They've registered more than 50,000 new cases in the last 24 hours. This morning, more than 400 deaths registered in the last 24 hours. It's of enormous concern because hospitals are saying their intensive care units are starting to reach capacity in badly hit parts of the country. Actually, some clinics are transferring patients to other hospitals in other parts of Germany. So the warnings about another wave of Omicron variant is of real concern. Let's find out what's happening just across the border in the Czech Republic. We can cross now to my colleague there, Rob Cameron.
Of course, the Czech Republic is one of the countries with some of the worst COVID figures in Europe, if not the world. The death toll from this pandemic has just exceeded 35,000, in fact. And while now the numbers are beginning to fall and perhaps the peak of this fifth wave in this country has been reached, in fact, we've just seen the number of new infections dip below 10,000 yesterday for the first time. That's by no means should be regarded as, like an early Christmas present for the new centre-right government that is being sworn in as I speak, because the problem, as we've mentioned, is Omicron. The Czech Republic doesn't do the same intensive kind and amount of synchronizing of PCR tests. So we don't know how far Omicron has spread so far in this country. The experts say it's presumably far greater than the few dozen official cases that have been recorded.
Rob Cameron ending that report from Prague. In the US, there's been a strong warning from health officials that COVID cases could jump by more than 50% in the next week, with deaths increasing by 70% from current levels by January. And this was President Joe Biden's message to those who have yet to have their jab.
For unvaccinated, we are looking at a winter of severe illness and death for unvaccinated. For themselves, their families, and the hospitals they'll soon overwhelm. But there's good news. If you're vaccinated, you have your booster shot, you're protected from severe illness and death, period.
I've been speaking to epidemiologist and health economist Dr. Eric Fagel-Ding about his predictions for the US this Christmas, and he says the idea that Omicron is a milder variant needs to change.
Unfortunately, most Americans still have not awoken to how serious Omicron is. There's way too many people who are complacent, have a very blasé attitude, think that with just 2 shots that they're protected enough. I think what President Biden emphasizes is good, but I think the booster language makes it sound like it's optional. With Omicron, it is not optional anymore. The efficacy we see with 2 shots of Pfizer or AstraZeneca are way too low. And they're like well below 50%. We need the boosters, and it can't just be a optional sounding language with booster. It needs to be mandated. A full vaccinated should be 3 shots.
You would go as far as to say that it should be mandated. Sorry to interrupt you.
Yeah, I think that the vaccine should be mandated, or any place that requires fully vaccinated should require 3 shots. We should reclassify the definition of fully vaccinated 3 shots. And that's what Israel is doing. And I think that is really key. But I want to emphasize the virus will increase exponentially way more than we can ever roll out the booster. So unless we want this runaway winter and Christmas to be really, really bad, we need to do something else. And one of the things is we need to toss these flimsy surgical masks and replace them with these premium KN95, FFP2, KF94 masks at minimum. And we should, of course, mandate them in public areas. But people need to switch to these premium masks.
Right.
And they have to really think about ventilation, air disinfection, and all these other measures, because vaccines are good, but we need to step up our game, because this is an exponentially spreading Omicron that will definitely outpace the rate we can boost people.
Now, you were one of the early epidemiologists in the States, at least to warn of the high transmission of the Omicron variant. Many called you an alarmist online. What is your prediction now, seeing what's emerging from the rest of the world? I mean, when you see what's happening in South Africa, that health officials are saying there that this doesn't seem to be translating into as high hospitalizations and deaths, how does that affect what you say?
Well, I think, first of all, the data from South Africa is still very preliminary. The time lag for deaths has not really surged yet. And in the UK and in Denmark, we're seeing Omicron models showing much faster hospitalization than Delta. Delta usually about 9 to 10 days. So Omicron, we're seeing hospitalization rising after just 6 days. And again, both UK and Denmark data is showing that. And I want people to remember, even if the virus is milder, and again, Delta was 3 or 4 times more severe than original Wuhan. Even if it's milder than Delta, we're still probably back at Wuhan. And even if it's 10 times less deadly, what will actually overwhelm hospitals and kill more people is when there's exponential increase of the cases.
Right, so you're saying just because of the sheer number of people that are getting it, that the number of people who will be seriously affected.
People infected will ultimately sicken and overwhelm all hospital systems for any country worldwide. And that is the concern.
That is Dr. Eric Fagel-Ding, the epidemiologist.